Good afternoon, everybody. Welcome to the latest in our series of talks. Have you thought of a career in medical research? We've got three speakers here today: Helen Stark, Martin Gillies, and Anna Ridley, and they will be talking with us shortly. I'd like to introduce our first speaker. So our first speaker is Helen Stark, and she is going to be talking to you for a bit about her career and also her research. Helen.
Okay, thank you very much, and hello to everyone. So just a little bit about my background. I'm a plastic surgery registrar, so that's a doctor training in plastic surgery. And at the moment I've taken time out of my clinical training to study for a PhD. And I'll explain a little bit about each of those parts as I go through the talk. I think when I first started thinking about this, I was remembering back to when I was doing my A-levels, kind of, I'm guessing around the time that you were now, and I didn't really know what I wanted to do at that point in time. And so I was thinking through how I got to where I am now. So the first piece of advice I was given at that time was just think about what I enjoyed doing. I was doing mostly science A-levels with French, and the things that I really loved was just figuring out how things worked. I really like to understand what made things happen or why things happened. And alongside that, I also liked fixing things. And you'll see a little bit later how this has kind of come through in what I'm doing now. I also knew that I wanted to work in a team with other people because I really enjoyed doing stuff in a team rather than just being on my own. And so that kind of led to me to deciding to study medicine. So I went to medical school. So that's 5 or 6 years, depending on where you go. And then once you finish, you graduate, but there's still more training until you get to be a consultant, which is kind of the end product of being a doctor, so the person in charge. And there are lots of different specialties, as I'm sure you're probably aware. And again, I had loved medical school. I enjoyed lots of different things. So I was having the same problems of trying to decide what I wanted to do. So this time, the advice I was given was to look at the consultants and see what they were doing and, see how their day was made up. So, did I want to spend time in clinic? Did I want to be in theatre, outpatients or inpatients, or did I want to be a GP? So using what the end goal of where I'd get to try and help decide which specialty to enter. And in my kind of final part of my foundation training, I had a job in plastic surgery. Now in the NHS, that means reconstruction. So people who may have had some form of cancer or have been involved in an accident or things like burns, and we do all of the kind of what's called soft tissue reconstruction. So it's a little bit different from cosmetic surgery. And I really enjoyed the plastic surgery. I really loved that rotation because I was able to fix things and solve problems for people kind of all in one go. So a patient would maybe come in with a fracture of their hand, they wouldn't be able to work, but once we'd done our operation and they'd had their rehab, they were then kind of fixed and back to work. And I found that really satisfying. So that's what kind of led me to choose to do plastic surgery as my career. Now, I think I mentioned kind of at the beginning, the other thing that I really enjoyed was figuring out how things work or why things happen. And so I'd kind of always had in the back of my mind that I'd want to do a bit more from the research side as well as being a clinician. And in order to do that well, the advice I was given was that you need to have a period of time which is really focused on your training from a research point of view, because you don't necessarily get the skills that you need for that doing a medical degree. So this is why I've taken time out of clinical training at the moment and I'm studying for a PhD. So this is a 3 to 4 year period of time. It's usually after you've already done an initial degree in an area, and you basically look and focus in on one area that you're interested in, and you have to come up with something novel, a novel finding for your thesis at the end. And one of the, so this was, I decided to do this quite a while ago, but it took about 3 or 4 years for me to actually achieve the goal of starting my PhD. And I think one of the other kind of things I learned along the way is that there's quite often a lot of rejection associated with applying for things like research. but that actually, and what I wished someone had told me before I started was that that's fine and it's okay, because all you need is to get one application that's accepted and then you're on your way. So I wrote lots of emails to lots of different supervisors. I applied for lots of different grants, and actually it's all worked out really well, and I'm very happy to be here in Oxford now and studying for my PhD. So just to explain a little bit about what my research is in, so I'm in a transplant immunology lab, and I'm looking at how we monitor patients for rejection. So if you're a patient who's had a transplanted organ, so a kidney or a heart, for example, you have to be on medication for the rest of your life, because your immune system is so good at recognizing when something is foreign that it tries to get rid of this transplanted organ. And this is a real problem for people if that's what they need to survive. The downside is that the medication has lots of other side effects. So we're trying to figure out ways to manage this better. So my work in particular is focusing on how we recognize that rejection is happening, because it can be quite tricky to know when it's happening. And the goal is to then be able to reduce immunosuppression, so the drugs that these patients are taking, so that they have better outcomes. Now, it might seem like a little bit of an odd thing to be researching for someone who's doing plastic surgery. The reason that I'm interested in is that I'm kind of really excited by the potential that reconstructive transplants might have. So this is things like, you may have seen patients who've had hand transplants or face transplants. So essentially, if they've had a really destructive, horrible kind of injury, we're not really able to fully reconstruct hands back to, you know, what a transplanted hand can do. The problem at the moment is this immunosuppression. So my kind of overarching ultimate goal is that if we were able to better kind of understand rejection and manage it, that more patients might benefit from reconstructive transplants. So that's a little bit of a whistle-stop tour of where I've got to so far. Thank you.
Thanks very much, Helen. That's great. I'm just going to see if anyone's typed a question. I can't see any at the moment, but I'm intrigued by hand transplants, Helen. Is that something we can do at the moment, or is your research a way of sort of paving the way to doing that?
Yeah, so hand transplants have, I think the first one was maybe in the early 90s. So they have been happening, but the big kind of controversy was, so the immunosuppression that I mentioned, the medication to stop rejection, ultimately it reduces someone's lifespan. So you don't live as long because of all of the side effects. Now, if a patient is having a transplant, say a transplant heart or a kidney, those are things that they need to maintain, you know, to stay alive. Whereas a hand, the argument was that isn't something that's life-saving. However, it is more accepted now that there is a lot that goes with getting hand transplants, which improve your outcomes. And it's now kind of, it's accepted that if you need two hands, so a double hand transplant, that the risk of the immunosuppression versus the benefit you get from getting the function of two hands is worth, you know, makes it okay on balance, although the patients have to be pretty carefully selected. It's less, now you wouldn't really see someone having just one hand transplanted, because the argument is they have got a functioning hand and the risk of the immunosuppression is too great really to, it's not a good risk benefit balance.
So we have had a question come in now, but thanks for telling me about the hands. It makes sense. So someone's asked how long it takes to study to be a consultant after medicine. I assume after you've finished your sort of first stage of medical training.
So yeah, so the university, so medical school is 5 or 6 years, and then everybody does foundation training, which is 2 years where you rotate around between kind of medicine, surgery, GP, A&E. At that time point is when you start thinking about which specialty, or you might have thought about this before. And then you go into, it would either be, for me, it was basic surgical training. So that's 2 years, again, where you rotate between different surgical specialties. And then you subspecialize. So I wanted to do plastic surgery. So that's another 6 years of training. So surgery, there are pathways which are shorter. So for example, if you want to be a GP, you do your 2 years of foundation training, and then it's 4 years, and then you're a GP consultant. But for the surgical specialties, it tends to be about 8 years, plus or minus a few years of fellowship. And that's doing it as quickly as you can. You don't always go straight to the next stage. So I took a year out after foundation training and went to Australia and worked in A&E for a year. So that's quite a nice. I thought that was a great opportunity to be able to travel. Other people might want to try a few other different specialties before they go through, or so yeah. But around kind of 10, 12 years to get from medical school finishing to being the consultant. But then after that, you've got about 30, 40 years of being the consultant. So, I'm in no rush to be a consultant just yet.
Fair enough. So we'll have a chance to ask Helen more questions at the end, but we're going to move on to our next speaker now. So our next speaker is Martin. He's also trained as a surgeon, and he's going to tell us a bit more about what he's getting up to now.
Okay, good afternoon, everyone. My name's Martin Gillis. So I'm a senior research fellow in neurosurgery. So I'm pure research these days, but I did train as a surgeon as well. So I've had a bit of an unusual career, I guess you'd say. So I went to med school back in '97, but I took 3 years out in the middle to do a PhD. I think you heard from Helen what a PhD is. It's basically an extended program of experiments with the idea of coming up with some new findings of some sort. So my PhD was in neuroscience. So pure basic science, nothing clinical about it at all. It was basically a pharmacology PhD. Unusually, it was sponsored by SmithKline Beecham. They're called GlaxoSmithKline nowadays. So I was actually supervised by a senior scientist at SmithKline Beecham as they were then. So they used to invite us down from time to time for jollies and that kind of thing. But they also gave they gave scientific supervision as well, provided resources to help with the PhD. It was a good deal. I came back to medical school after I finished the PhD to finish three clinical years, as they were called. The good thing about having done a PhD in the middle of medical school was I was able to be employed as a tutor. I was at Oxford, so I was a tutor for Keble College in neuroscience. So that provided a bit of income, as well as being able to do the kind of clinical training. So like Helen, I did 2 years of foundation training, different subjects, some surgical, one A&E, a couple of medical specialties. Then I applied to neurosurgery and got a run-through, it was called. Run-through just means a contract which lasts for the 8 years it takes to train you to be a neurosurgeon. But also, one of the advantages of doing the PhD early was I had the opportunity to apply for something called a postdoc while I was doing my surgical training. So these positions, they're quite new. I think they've only been around for the past 10 years. They're called academic clinical lectureships. And what that is you do surgical training or medical training, whatever subject you're doing. And it gives you extra time to be able to do postdoctoral research. Postdoctoral research just means the same kind of research you do as a PhD, but you're more independent. You can pick and choose what research you do. And the aim of that is to be able to get a grant to become a clinical scientist. So someone who's employed by university as well as the NHS, and maybe does 50% of the time on clinical work, 50% of the time on research, or it may vary from place to place exactly what the breakdown is. Unfortunately, I got a condition called multiple sclerosis, so I had to give up a surgical job. But because I was dual trained, because I was PhD with postdoctoral research for 6 years, I've been able to take a science job in neurosurgery. So that's great. I think it's an absolutely fantastic job. So I do teaching as well as research for the university. I'm able to pick and choose what research I do, so I do what interests me. The kind of thing that interests me, so the brain is a fantastic organ. I mean, who knows how it works? I knew how it worked when I finished my PhD. I could have told you exactly how it worked when I finished that. But having done neurosurgery and done postdoctoral science on the brain, I have absolutely no idea basically how it works. But it's fun kind of trying to work it out. I think it's like a UFO, and maybe at best we can work out how the electrical windows work. But it's fun trying to discover more about it. So in terms of research I do some clinical trial work. So we are in the process of setting up a trial using neurosurgery to treat pain. So that may sound dramatic, but pain is one of the oldest indications for neurosurgery, done at least since the 19th century. But maybe the Egyptians, they were certainly doing neurosurgery. I'm sure some of that was for pain in those days, 5,000 years ago. I'm also interested in like how does thinking work at a cellular level. So the brain is pretty well understood at a cell level, microscopic, looking down the microscope type level. And the brain is also quite well understood on a behavioral level, like we've got anthropology and economics and all these subjects. But how do you go from those little cells up to something dramatic like writing a symphony or something like that? So that's the kind of research I'm interested in. How do you go between the two? What else? I enjoy teaching as well. I like teaching about neurological emergencies and about how the spine works, that kind of thing. So I think you might not hear much about science work in medicine, but it's certainly an avenue you can explore. And what I recommend for that is giving it a try. So give science a try when you get the opportunity. So when you do whatever university you go to, do your third year project, see if you like science. And if you do, think about a PhD and think about it early rather than late in your career, because it's miserable doing a PhD as a registrar sometimes, because you've got you're on call and you've got your family and you've got your mortgage and everything. So early is quite a good time to do it. If you're interested in applying for science, do think about what careers you might want to do. So a PhD opens a lot of doors. So for example, I was offered a job at GlaxoSmithKline after my PhD, pretty well paid, maybe a little bit boring because you just have to do the research they wanted you to do. But there's also independent science in university, which is worthwhile teaching all kinds of different things. So just wrap it up there. But if anyone's got any questions, feel free to ask.
So we just had a question come in. I'm just going to read it. Thanks very much for that, Martin. Okay, so someone was saying that, would you say that doing the combination of neurosurgery and a PhD offered you more career options? And what would be the challenges of doing both surgery in the NHS and doing research?
So the kind of challenge is just time, basically, because not just neurosurgery, any kind of surgery is a kind of apprenticeship. So you can only learn it by doing it, essentially. So you need to do, 100 appendectomies, or in neurosurgery, it's chronic subdural hematomas. It's a kind of basic operation, I would say. So you just need to do 100 of them, and they take an hour each, say. So that's 100 hours of training just to do one procedure type thing. And you've got to learn lots of procedures in neurosurgery anyway. Probably in most specialties, I don't know what it would be in other specialties, but certainly there'd be a chunk of operations you just have to learn off by heart. The challenge of doing research at the same time as your surgical training is, just finding time, because you might be in your 30s, have family, have a mortgage, as well as having to do your research and do your thing. And research can be like banging your head off a wall sometimes. It can be pretty difficult to get your experiments to work, or to find the patient group you need to interview, or whatever it is. In saying that, though, the advantage of doing a PhD earlier in your career, say after foundation job, is you can then apply for these postdoctoral positions, the ACLs, and those are definitely easier, I'd say, than doing a PhD. Maybe not in every case, but you've got a bit more freedom you're not having to write a thesis, you're just having to write papers, and maybe get a grant as well, apply for a grant as well. So it's not quite as pressured as a PhD, I would say. And you've got more freedom because you've done a PhD. A PhD is like a driving license. It kind of gets you qualified to the state where you can be an independent researcher. So that's what the advantage of doing a postdoctoral position during a surgical training. You can kind of go down your own path a bit easier than you could with a PhD, for example. It kind of distinguishes you as well. It's quite unusual in surgery to have done postdoctoral research. So it's kind of good for your CV because it puts, it's like something a bit distinctive type thing. Sorry, can you just read the question again? I forgot what the first part was.
It was really just the advantages and disadvantages of trying to do both at the same time. So I think you might have pretty much covered that.
Yeah, I mean, lots of people do PhDs during their surgical training, and they get a PhD fine. And it does improve your chances of getting a consultant job as well. And it gives you a chance of having a more interesting job, I would say, a job that's a mixture of clinical and research. So that's the kind of advantage of it. Disadvantage is, it can be difficult doing both at a time. So I always recommend for people to do them earlier rather than later in their career, if they can. It's not always possible, of course.
Okay. Thank you, Martin. Okay, so we're now going to move on to our final speaker, Anna Ridley, who's going to talk a bit more about her research and how she got to doing what she's doing now.
Thanks, Natalie, and hello to everyone. So I'm actually a pure scientist rather than a clinician. I've worked in several different settings, so I'm going to take you again on a whistle-stop tour through those different things. So I studied biology, chemistry and geography at A-level, and afterwards I gained a position to train as a clinical scientist in immunology, where I worked at Southampton General Hospital. That was several years ago, so it's now been renamed the NHS Scientist Training Programme. So when I did it, it was a 4-year training programme. There were positions throughout the country. It's now 3 years, and you do a more generalised first year, and then you specialise in the second 2 years. As I said, I did clinical immunology, but there's all sorts of different disciplines you can do. Some where you're more patient focused, like audiology and radiotherapy, and then some that are more lab focused. Like I said, I did immunology, you could do biochemistry or hematology, but it's essentially kind of filling a gap between completely lab-based and being a clinician. So you're learning how to do the tests and to interpret the tests. So the training itself involves rotating through the different labs in the immunology section. So just to give you a kind of an example, there was a molecular immunology lab, and I would be involved in tissue matching for stem cell transplant. And then there was a large immunohistochemistry section, and there I was involved in diagnosis of different allergy and autoimmune disease. So one of the reasons I got into immunology in the first place is because my grandmother suffered from a disease called rheumatoid arthritis, and that's where the immune system, whilst normally protecting us from infection, can actually turn on itself. So here in rheumatoid arthritis, it affects patients' joints. So she had problems with things that you and I would take for granted. So just getting dressed and walking up the stairs. So seeing her suffer with something like that was kind of what piqued my interest to begin with. So as well as rotating and working in the lab, as part of this training scheme, I did a 2-year part-time master's in medical immunology. That was at King's College. And it was, sounds like a prisoner, but it's kind of a day release where you would go 1 day a week to study. And as well, a real perk of that particular job, and actually indeed now that I'm in academia, is attending conferences. So both in the UK and worldwide, obviously not at the moment, but before and hopefully again in the future, I've been able to visit some really interesting places. So at the end of the training scheme, I had to tie everything together by putting a portfolio together and then having an oral examination. And afterwards, there's kind of a bit of a bottleneck in that there's more trainees than there are permanent positions. But with all the different things I'd learned and skills I'd acquired during that time, I was then able to apply elsewhere. And I actually started working for a company up in Oxford called Oxford Biomedica. And they're most famous at the moment for being the largest manufacturers of the AstraZeneca COVID vaccine in the UK. And there I was performing clinical trials. So this time it was on cancer therapies. And here you're looking at patients, well, you know, Martin's sort of set the scene a little bit for me, but you're looking at a group of patients treated with a certain therapy that's been developed by the company and comparing that to patients that have been treated with a placebo, so that's not thought to have a therapeutic effect. And in that way, you can see if it's the drug is really having a positive effect. So kind of on a day-to-day basis, the things I was doing, as well as testing patient samples, was I was setting up new tests, and also the general things you associate with working in a lab, like maintaining equipment and machines, doing general ordering and tidiness and things like that. Just any job you have, there's the routine things to do as well. And I worked there for about a year, and then I decided, actually, you know, that was very interesting, but I really wanted to do my own research rather than, you know, as Martin said, being directed in what to do. And I was lucky enough to join a lab working on inflammatory arthritis at Oxford. And I became, first of all, I became a research assistant because I really wanted to see what the role involved and what academic life was like. And then after a year, I decided with my boss's support that I really wanted to get more involved in the research. And that's when I enrolled to do my PhD. And during that 4 years of study, I was really interested in a subset of cells called the T cells. And I kind of think of these as the conductors of the immune response, but also they can turn against us. And these are the cells that can actually, you know, attack our own bodies in these kind of autoimmune diseases. So after that period of, like I said, 4 years in my case, I decided that I was really interested in carrying out my own research. So I stayed in that academic setting, and I'm now a postdoctoral researcher. So it's much more, I'm carrying out my own research. The other kind of things that I'm doing would be writing up my research to publish in articles. I'm apply for different grants. Again, as before, there's mundane things and more general lab duties to perform. But some of the things I really like doing are supervising the students who come through our lab, and also training up new members of staff. In terms of what I'm actually researching, I'm involved in a couple of projects, but the main one at the moment is a collaboration with an artificial intelligence company. And what they do is use these algorithms to screen the literature and journal articles. And they're looking for drugs that they think might work in arthritis. So these are drugs that are approved, that they're used in other conditions at the moment, but not in arthritis. And then I'm taking samples from patients that suffer from arthritis and seeing if these drugs have any effect on their cells rather than the patients themselves. But the idea would be eventually to use them in patients. And then one other hat that I wear is I've been involved in the past 5 years in teaching at St. Hilda's College, mostly medical and biomedical science students. In the tutorial system, but in my role as a postdoc, I'm also giving lectures and I'm running workshops, and that can be more specialized in immunology, but also some more juicy topics like scientific misconduct and how you can avoid that. So yes, if there's any questions, yeah, please feel free to ask.
Thank you, Anna. That's very interesting. I don't think we've got any questions come in for you specifically at the moment. I had a quick question. So you say that you're using AI to look for potential drugs that might be helpful in arthritis and testing them on human tissue. So say you found something that worked amazingly in your samples, of your human tissue samples. What sort of timescale would it be to potentially seeing that actually being offered to a patient?
So if it was something completely new, these things can take an awfully long time because there's a number of different phases you have to go through in clinical trials. But actually, these drugs are ones that are already approved for use in patients, but being used in other indications. It would still take a lot of time to validate, the findings, but it's certainly not the several years and years that it can take for in a clinical trial. Natalie, if you don't mind, there's just a couple of things I wanted to add in terms of advice that I'd been given.
Yeah, sure, go for it.
That I forgot to mention, but I think hopefully will be valuable. The first one was just to say, don't panic if things don't go as you expect in your career, because I said that I studied at Southampton University for my undergraduate degree, but I was actually rejected from my first choice of Warwick University because I didn't get the grades that I wanted. I missed out just by 1 grade. And actually, I took a year out, I took stock, and then I went and did that degree. And that for me worked really well because it was a very broad degree. Other thing that's really helpful, if you can, I know it can be harder said than done, or easier said than done, but is to try and get some work experience. And every holiday I had at university, I would just email and speak to people, just larger companies. I worked for Syngenta for a little while. They have departments and they will be happy to place some summer students. So it can be difficult, but if you contact lots of people, then there will be opportunities out there. And also, as Helen said, my other advice is that if this, what you like to think about is something that you're particularly interested in, because you're going to be spending a lot of time doing that. It's a real investment of your time. So you really want to be doing something that you find fun and interesting. Thanks, Natalie.
Thanks, Anna. I think that seems to be a bit of a common theme that's coming through all these talks, that nothing is completely irreversible if you don't get the grades that you want, or you start something and you discover actually it's really not for you. There are definitely opportunities to change. It may not be the easiest of paths, but nothing's sort of completely irreversible, really. So you can usually find your way somewhere. It's probably best just to sort of keep calm, as you say, take stock, have a think about what you enjoy doing, and perhaps ask yourself why you wanted to do a particular job, and if there are very similar jobs that you could get as much benefit from or enjoy as much, that aren't perhaps the thing you had in mind at first. I don't think we've got any questions coming in at the moment, but I'm going to ask you all a question. So at least a couple of you mentioned that one of the reasons you wanted to do a postdoc was because you wanted to do your own research. But I mean, how do you decide what you want to do research in? Do you just sort of sat in a room and you're trying to come up with ideas for research, or was there something that sparked off a particular sort of interest? Where do your ideas come from for what you're now researching? Does anyone want to start there?
I'm doing a project, like I did my PhD 20 years ago now, I think it was 2000 roughly. And I'm now about to start a project doing the same type of work in human brain slices, actually, rather than rat or mouse hippocampus. And I did the PhD not because I took the 3 years out of med school, which was a bit of a gamble at the time. Not very many people did that. I only know one other person who's ever done that, actually. But I enjoyed the science so much. Like I don't know what it was about it. I just really liked it. I think it was a bit of a mixture of maths and biology, and I don't even remember quite, but I just liked it, and I liked the lifestyle of science as well. I liked going to conferences and going to the pub on a Friday after work type thing. I just liked the lifestyle type thing. But because I'd done the PhD all those years ago, like I saw the opportunity to do these experiments again 20 years later. So I think like when you find something you enjoy, you can actually see how it fits in with your clinical work or with whichever kind of work you might be doing, drug company work or whatever. Yeah, so I think once you've learned some techniques, you can kind of then apply them to new situations, and I think that's what you get the opportunity to do as a postdoc. Maybe not the initial few years of a postdoc. Often that's just continuation of PhD work. But once you get on in the postdoc a bit, once you can start to become more independent, you can start to use what you know already again, or what you like.
Thank you, Martin. Did anyone else want to jump in on that one? Sort of your inspirations for your research area, or how it came to you, or what you did?
Yeah, I can chip in there. Just to say, I mean, I mentioned that I had a personal interest, on a level, having a family member suffering. And then that's kind of what drove me to get into the area of arthritis research to begin with. In terms of now thinking of like my own research and ideas, as you get more involved in the subject, you get exposed to more. I mean, as I said, a perk of the job is going to these conferences. And for me, there's some really, seeing inspirational speakers and hearing them talk has had a real impact and reflected on the way that my research journey has carried. So.
When I still keep in touch with my first supervisor as a third year student. We've known each other 21 years now, but anyway, she said once to me, like, research is like being paid to do your hobby type thing, which I don't think that's true early on in your career. Like, I don't think that's true when you're doing your PhD necessarily. Maybe it is sometimes, but I think as you get on in science, when you get to the stage where you have your own grant that you've applied for yourself, and you've got your own kind of workflow. Like I'm starting to, I kind of agree with her now, actually, after 6 years of postdoc, that it's like being paid to do a hobby.
I guess I would agree with a lot of what has been said already, but a real thing for me was like in clinic. So when I was like operating or seeing patients and we didn't have a good solution for their reconstruction, that was then like, okay, well, how do we figure out what are the things that are stopping us from being able to do this? And then now, as I'm doing more lab-based stuff, I'm realizing, oh, this has happened, but I don't really understand why this has happened. So what do I need to do to figure out why that has happened? And then you start going off on all these, or I have started going off on all these, like, kind of not, they don't seem connected, but they all kind of end up linked. And yeah, like Martin was saying, it's fun. You get to just answer questions that you've come up with, and that's really cool because you're finding out stuff that people don't know. So yeah.
That's great.
It's creative, I guess, science. Like it's a bit of a craft specialty.
I think it'd be interesting to know if you had any advice for, if you could go back in time, I guess, and you had any advice for someone who was just starting out, or yourself. What advice do you think you'd give in hindsight to your, let's say, to your former self? So.
Well, I've said it before, Natalie, but I will say it again,
yeah.
Is not to panic.
Yeah.
Because I genuinely, when I didn't get my A-level grades by 2 points, I thought it was the end of the world at the time. And then when I trained as a clinical scientist, that was it. That's what I was going to do with the rest of my life. And then there wasn't that opportunity. But each time it's led me to something else. And in each thing that I've done, there's been some fascinating, there's been some mundane bits like there is in everything, but there's been some really interesting opportunities, and I've met some absolutely fantastic people. And as these guys have said, now I get to play in the lab every day, as well as the routine and mundane things. But if I'd have asked myself just after getting my A-level results and it wasn't what I wanted, I thought that was going to be the end of it. And yeah, so don't panic is my advice to my former self and to you.
Fair enough.
Advice my dad used to give me is say yes to everything. So I said yes to taking 3 years out of med school for PhD, yes to going to wherever, San Diego or Paris or wherever for a conference. Yes, when my boss said, do you want to do this operation on TV? In fact, once I did an operation on TV and my boss didn't tell me there was going to be a camera crew. Actually, it was just a surprise. But, you know, you say yes to things. You know, your boss says, do you want to have a go at suturing this wound? If you want to be a surgeon, then say yes, you know, say yes to things. Don't be afraid to like make a mistake or that kind of thing, you know, just say yes to things.
Helen, did you have anything?
I guess one thing, I felt like I was told quite a lot that what I wanted to do maybe wasn't possible or was going to be hard, or that I was like questioned quite a lot. And I don't really know why, but I ignored it, which I'm pleased about because it kind of has ended up working out okay. But I think it is very hard sometimes because in terms, I guess I didn't really talk much about before, but I was like, no one in my family is medical. So my kind of family don't really understand the structure or how it works. So they'd always be like, are you really sure you want to do this? Which takes even more time to do, you know, that. And then when I wanted to do like surgery and plastic surgery, and people were like, that's really competitive. Are you sure you really want to do that? And I did mention like all of the rejection letters, which make you feel like maybe, you know, do you really want to do this? And I'm like, I don't know, for me still, it's still been very worth it. I'm very happy that I kept doing it. So I think if you really want to do something, don't worry if it doesn't work out straight away, keep going. And like Anna was saying, it can sometimes lead you into really good places as well, even if it's not quite what you initially thought.
Okay, we have had the question come in now. Do you have any, and I guess this would be mostly for Martin and Helen, do you have any advice for getting into an undergraduate medicine or medical sciences degree? They've said at Oxbridge, but I mean, I think more generally it would be useful as well.
So I think I usually say this to people because Tipu and Alex, the professors in neurosurgery, always send people to come and see me about this kind of thing. But my advice is just make sure you have an opinion on medical issues if you're applying for medicine, science issues if you're applying for science as well. And what I mean by that is the kind of issues that are maybe in the Guardian or the Telegraph that month or something like that. Just have an opinion, and it's a good idea to like maybe read a basic, not like a technical textbook, but like there's this series, a very short introduction to or beginner's guide to medical ethics or philosophy, or I don't know what, like you know, medicine or something like that, and just like have something to say about these things. So COVID is going to be the big one, I guess, because, you know, should vaccines be off patent, for example, or should they? Who should get the vaccine first? Or if you have 10 vaccines, who are you going to vaccine first? Is it going to be the key workers in the care home, or is it going to be the 80-year-olds or 70-year-olds who have heart attacks or something like that? And the important thing is you don't have to agree with the person who's interviewing you. It's good to just have your opinion and be able to defend it in some way, because that's the kind of thing that'll make you stand out at an interview. Because probably everyone who applies is going to have good grades. You know, the grades are going to be pretty similar across all the candidates, but being someone who, you know, has a bit more than that, essentially, you know, has an opinion about something, that's, because I mean, if I was doing interviews, I'd definitely ask about COVID this year, you know, since it's the biggest public health issue that there's been for quite a long time, you know. But you know, it's just, I think it's important to maybe read a Sunday newspaper. Doesn't really matter which one, just one of the broadsheets, just so you can kind of keep abreast of things in the news. You know, like ethical issues, for example, like a child denied treatment because NICE doesn't fund the drugs, who's gone to Italy for experimental treatment. These kind of thorny issues come up in interviews.
Helen, did you want to add anything?
Yeah, I think there are maybe two things I would add. I agree with what Martin was saying, totally. I think the other thing that they like to know is that you have an understanding of what being a doctor like actually means on a more day-to-day basis. So, you know, the classic is, you know, why do you want to be a doctor? And not just saying because I want to help people, but kind of, I don't know, demonstrating, and that might be you've spoken to someone or you've managed to do some work experience, but you don't have to have done work experience. It can be, you know, just knowing what the training program involves. So it just shows that you've done a little bit of research and you kind of do know what you're getting yourself into, I think is a good thing to be able to show. And then the other thing, which I think is maybe, because I know you were mentioning that it was specific to Oxbridge interviews, one thing I think I found was that don't be too, you won't be able to prepare for every question that might possibly come up, but what they're actually looking for is just how you think and how you kind of respond to maybe not knowing an answer. So, you know, it's kind of a bit like, I don't know, so I was thinking about, so in my interview, I was asked why octopus's blood is green, which, I mean, obviously you're never taught that, like that's not something that's on a syllabus, but it was just to kind of provoke you to think, or to use knowledge that you already have, say about, you know, human blood, because I think that's it was part of my A-level biology, why that was red, why octopus's blood might be green, and then just being able to talk through something. So it's kind of a hard thing to practice, but it's just kind of almost like logical thinking, or being able to talk through a problem out loud, and not be too, don't worry if it's something that you don't think you know the answer to, just, yeah, see if you can work a way around it, I guess.
Excellent. You'll now have me pondering for the rest of the afternoon why octopus's blood is green. You'll have to tell me later, maybe. Was there anything you wanted to add to that, Anna?
So I actually get involved in admissions interviews at St Hilda's for the biomedical scientists, just for the last couple of years. But again, it's very much topical things that we like to ask. And I'd echo what Helen said. It's not, you know, it's the way you think about it. And so it's okay just to take a few seconds to think first, to clarify your thoughts. You know, I don't want to hear someone who's just answering what they would like to talk about. It's, you know, can you think about what you've been asked and give that specific response?
Excellent. So we're actually pretty much coming up to 3 o'clock now, so we're probably going to stop. Thanks to all of you who attended. Thanks for the questions that you asked. Thanks to all of our wonderful speakers. It's always very interesting for me because my background isn't in medicine or medical sciences, so I always like to hear what people have been up to and how they got to where they are. So I think we'll just wrap things up there. So thanks again to everyone who's come along this afternoon, and hopefully we'll see some of you in about a month's time. Thank you.